I'm Dr. Diane Cleverly, Personal Healthcare Information. Welcome to this episode of How to Hack Healthcare, What Women Need to Know. Healthcare policy for many countries tend to focus on women's issues, which is contraception, pregnancy, breast and ovarian cancer, and menopause. In today's video, we'll be talking about pregnancy hacks. You're actually at a greater risk of death when you're pregnant than when you're on birth control. The U.S. in particular has a high maternal death rate that has been rising rapidly, and Canada is right behind it. The U.K., however, has been trending downward. They're doing great. One of the reasons for this increase in death rate is lifestyle factors. So women are heavier. Obesity in itself increases risks. They also have diabetes, which increases risks and complications. Hypertension, which increases risk and complications. You can see what's going on here. But the other thing is the cesarean section rate. So when you have a C-section, it increases your risk of post-C-section embolism or blood clot, which can kill you. So there are a lot of issues going on here as far as the pregnancy and the risk that you should be aware of. The hacks. What's really important for being pregnant is that you get prenatal care and counseling at least 3 months prior to getting pregnant. And this is easier said than done. Unexpected on the pill, then 1 in 3 pregnancies are unplanned. So people do not plan to get pregnant, they can't do good prenatal care. Also, the maternal death that we just talked about, they did surveys and found that a number of those women did not have prenatal care prior to going into the hospital, good prenatal care. One of the things you can do most to help yourself is to lose weight and control diabetes if you are overweight and your hypertension before getting pregnant. So that way, those are some of the risk factors for the maternal death. You can control them, then you're in better shape when you go into the pregnancy. Also, when you go, be very assertive. Do not be afraid to request ultrasounds, request blood tests, track and be aware of any unusual symptoms, and also tell these to your physician in an organized manner. Do not be afraid to take maternity leave. You're entitled to. Many countries have maternity leave policies, and you may be entitled to more maternity leave than you realize. Another thing that's very important to do is to check the certifications of your provider. You can check the certifications of your obstetrician online. I have the link there on the slides. You can check that your midwife has been fully certified in the regulations of your country. This brings us to breastfeeding. How popular is breastfeeding in your country? Do you know? I was really surprised to find out the UK was one of the lowest breastfeeding rates, and that the US, which I thought would be the lowest, was not actually that bad. It's 35% at this point. But the big surprise was Hungary. Hungary, you have nearly 100% of women breastfeeding. And so I think we need to look to Hungary as a model and figure out if that country is doing it right, what can we do to increase these breastfeeding rates? Oh, in the U.S., they have a lot of things now in the ACA to try and improve breastfeeding as a way of life for women, mothers, young mothers. They provide free lactation support. They pay for the cost of renting breastfeeding equipment, which can be pretty costly. And they have employee-mandated breastfeeding areas and time set aside if you work. Now, you may or may not know that the mandate says this place cannot be the bathroom. So you are not expected to be pumping breast milk in the bathroom at work. The ACA pretty clearly says it has to be a separate area, separate private area. Now, in Europe, there are the maternity protection laws, right? So there's the International Labor Organization standards, and they have minimums. Many countries will go above and beyond that, and they will specify breastfeeding laws and employee mandates and things like that. Not all of them do, though. And one interesting thing I found out looking into the Hungary connection was that in Hungary, women do not feel that breastfeeding is challenging. And so they're the only country that came back with that attitude, and I think as barriers get lower, maybe more of us can feel that way as well. So that's it. I hope that you enjoyed this episode of How to Hack Healthcare, and always remember, you deserve to be well treated. And if you like these webinars, you can check out some of the other How to Hack Healthcare webinars. And if you need more help, if you need personal help pursuing diagnosis and treatment, we can also do a workbook and a workshop for that. So you can register at that at www.personalhealthinfo.weebly.com, which is my website. And any feedback at all or suggestions for topics is greatly appreciated. I have a number of topics I'm planning to cover, but it's always better to hear from you guys and find out what you're interested in learning about, hearing about, what can help you, anything like that. If you subscribe, all the better, because then you'll get all the latest updates. So thank you very much, and we will see you next time. Bye. Thank you for listening. And for more information, please visit us on the web at personalhealthinfo.weebly.com.